Today we're going to be talking about the external anatomy of the heart. And to begin, we're going to talk about the four chambers of the heart. The first is the right atrium, occupying this area here, that is connected to the right ventricle. The right ventricle is located on the anterior side of the heart. And then we have the left atrium connected to the left ventricle. The left ventricle is located lateral and more posterior to the heart in comparison to the right ventricle. Now we're going to get into the surfaces of the heart. And to begin with that, we'll start on the anterior side, and this is referred to as the sternocostal surface. Next, we have the right surface here, which is referred to as the right pulmonary surface. And we have the left pulmonary surface. And now down here, we have the inferior portion connected to the diaphragmatic surface. Now, if I turn it around to the posterior side, you have the base located right in this area here. Housing the four blood vessels of the pulmonary vein going to the left atrium. Turning it back around, we have the apex of the heart positioned at the point of the left ventricle at the level of the sixth costal rib. Okay, next we're going to be talking about the three grooves to the heart. The first is going to be the cardiac sulcus running horizontally, separating the atriums with the ventricle. And the next is going to be the anterior intraventricular sulcus going down, separating the right ventricle from the left ventricle. And the next and third is going to be on the posterior side, and it's referred to as the posterior intraventricular sulcus. All these sulcuses are protected and lined with epicardium fat, referred to as epicardium fat pads. Those fatty tissue is protecting the blood vessels and giving the outline of the exterior surface. Okay, before moving on to the coronary blood flow of the heart, we need to talk about the three layers of the heart in reference to the myocardium. So if I open this up and briefly speaking about the internal structure, we have the epicardium, which is the outermost, the myocardium, and then the endocardium. So the myocardium is what is important in regards to the coronary blood flow of the heart. Okay, before moving to the coronary blood flow, we're going to speak in regards to the three great vessels seen on the superior section of the heart. The first is the superior vena cava here, bringing deoxygenated blood into the right atrium. Then we have the aorta, bringing oxygenated blood out from the left ventricle. And then we have the pulmonary trunk, bringing deoxygenated blood from the right ventricle. Good way to remember this is the mnemonic SAP is S for superior vena cava, A for aorta, and P for pulmonary trunk. Okay, before I begin with the coronary arteries on the outside of the heart, we're going to start at where the coronary arteries begin from. So the first is the right coronary artery and the left coronary artery, and that is coming from directly from the aorta. So just after the blood passes the left ventricle through the aortic valve, it's going to begin the coronary blood flow right at this point here, which is referred to as the right coronary cusp that opens up, giving blood to the right coronary artery. The left side also has it, and that is referred to as the left coronary cusp, delivering blood to the left coronary artery. Okay, so now the left coronary artery is a small little segment of the artery, and it immediately bifurcates. So it will bifurcate to the left anterior descending and then the left circumflux artery there. So the left circumflux artery extends all the way to the posterior side, and then it also has a small bifurcation to the left marginal artery, and also referred to as the obtuse artery. On the front side, that left coronary artery that bifurcates to the left anterior descending, the left anterior descending is also referred to as the interventricular artery. So this interventricular artery will branch off into diagonal branches. Okay, next we're going to talk about the right coronary artery. It begins from the aorta at the right coronary cusp and will travel along with the cardiac sulcus, just below the right auricle of the right atrium. So that right coronary artery will give way to the conus branch, the ventricle branch, and then it will bifurcate to the marginal artery going to the right ventricle, and it can anastomose with the left anterior descending. The right coronary artery will also bifurcate and turn it into the posterior intraventricular artery here. Next, we're going to talk about the coronary sinus located on the posterior side at the level of the base of the heart, collecting blood from the three major cardiac veins. This blood vessel is a short, wide vessel collecting all the deoxygenated blood, which would deliver it to the right atrium. Turning this heart model over, removing the outer layer, we can see the right atrium. There is a small opening here referred to as the coronary sinus opening, protected by the semicircular valve. That can be seen in the right atrium just below the fossa ovalis. Now we're going to talk about the coronary veins of the heart, the venous drainage, draining deoxygenated blood from the myocardium. The first is located on the anterior side, referred to as the great cardiac vein. The great cardiac vein can be seen here, coursing with the left anterior descending coronary artery. The great cardiac vein will travel distal to proximal, and it will course with the circumflex branch of the coronary artery. The great cardiac vein will continue as the coronary sinus here. Below the coronary sinus, on the posterior side, you have the middle cardiac vein traveling distal to proximal. Turning this model heart over on the lateral side of the right ventricle, you have the small cardiac vein. The small cardiac vein will also course towards the posterior side and merge with the coronary sinus here.